Good morning, everyone, and welcome to today's live session with Fasa. Joining me today is clinical development expert Dr. Jacques Snyman, who is a medical director of Agility Health, and he's also the medical advisor to Health Square Medical Scheme. Dr. Snyman is the former head of pharmacology at the University of Pretoria, a role he has served in for some 20 years. And he is also the past president of the South African Society for Basic and Clinical Pharmacology. So good morning and welcome to you, Dr. Jacques Snyman.
Morning, Rami, and morning, listeners.
Good morning, everyone, and welcome as well. If you have any questions or you want to pop a note to say hi, please do so at any point in time. We'll answer your questions as best possible. So today we're going to be discussing medical aid and what to look for when choosing a medical aid scheme for your business. So thankfully, we've got Dr. Jacques to help us answer these questions. For businesses that provide medical aid for their staff members, what should employers look for when choosing a medical aid scheme?
Well, first of all, I think they need to understand what the business they are in, where are they located, and what do they really need. It's often easier that medical scheme selection is often a knee-jerk reaction, is to say almost a discussion that you have somewhere, and you say, what do you think I should have? And it becomes a human resources discussion instead of it becoming a real analytical decision around what's the need. Do I run a manufacturing company, and this manufacturing company is a bit out in the sticks, and what will the cover in this particular area be, and will that cover be sufficient for my workforce? And those are the very important things. And sometimes you can get very good decisions from just looking at that. Do I need certain savings accounts? Do I just need a classical medical scheme or traditional? So all of those decisions needs to be taken into account. What can I afford? And is what I can afford sufficient to cover my employees? If I've got a very young employee base versus a very old employee base, all of those need to be taken into consideration.
Okay, so when you say what is the location, why is it location based, if I may ask?
So if for instance you have a mining operation or a forestry operation, there's no sense in having a benefit that you can only access within a city. I would love to have that access or something that makes sense within my environment. What is your provider or your network provider footprint in my area? Do you have a network provider footprint? Is the hospital in my area contracted? Do I get the contract with a doctor that's already looking after the occupational health in my particular employer environment? So those are the factors that one needs to look at. It's not just making a decision, and eventually you have these things in silos. Of my occupational health in a silo, of my medical scheme in a silo, and how do I bring them all together? So it's good to make those decisions or assessments up front before you make a decision. If you have a very young group and they like to play football and they like to do other things and they're not into gym, it's very silly to have something that gives you a gym opportunity, just to give you an indication. Or I have a employer that use a lot of manual power that needs heavy lifting and they may need more physiotherapy. Is there physiotherapy that's contracted, physiotherapist that's contracted close by? So it's stuff that you need to think of when you do. It's not to say that one scheme will fit all. What's the scheme's integration with other products that will make more sense for me? And then obviously with this COVID pandemic, it's just don't go without.
Okay, well, that makes a lot of sense. I never really thought of it that way before when it comes to medical aid. I didn't think about, I have to consider the kind of work that I do, or even for businesses. I mean, I'm thinking now as an individual, but if I had staff, I need to think about the kind of work that we do and would that the health repercussions of that business be? So for instance, because I'm an office worker, I guess my medical aid would be different in relation to, because I work behind a computer all day, sitting in an office all day, that kind of things I would have to consider. So am I getting that right, listening to what you say?
Correct. And remember, it's not often that you, not only the scheme, you also need to unpack the options or the different option plans within that particular scheme, because that will also give you an idea of, does the scheme offer the cover within a plan option that I can actually utilize? What are the primary care needs that I need? Is it that I need unlimited access to a general practitioner because this is my primary port of call? That is what I need. The fact that I've only employed male and no females is purely because of the nature of my business. Do I need obstetric care? Nobody's going to get pregnant unless I've also got cover for their beneficiaries. So as soon as you need to unpack it properly to make those decisions.
Okay, yeah. So that's really not a quick decision at all. Now, many employees would be able to provide, many employers would like to be able to provide access to private healthcare for their staff, but are concerned this may not be affordable, especially in the current financial climate. What are their options?
There are other options other than medical schemes, but often these are insurance-based products, and the insurance-based products may look more affordable initially, but the problem is that they all have rand value limits to what can be covered, and those are regulated. If you're then in an accident, your rand value limit will most probably move you into a state facility very soon, purely because you run out of benefits. Say you need an ICU for 2 or 3 days, that hospital type of cover would run out of benefits. So your medical scheme, if you can at all afford it because of the PMB regulations, remains the cornerstone. So if you can afford anything, that is what you need to look at. If you can't afford it, then you may look for some cover at this others. And again, depending on your employee base, you may opt for something that just offers primary health care over and above your occupational health that you need to cover in it, because that will go a long way in sort of mitigating against the risk within your workspace.
Okay. Just want to quick give a shout out to Given. Good morning, Given, and Juliet. Good morning. Thank you for joining us. And thank you to Margie as well for joining us. And now you said something about occupational healthcare, primary healthcare. Is that different in costs, or what is the difference?
They're governed under different laws. So your occupational health falls under your labor act. So that if you're in a mining environment, certain pre-specified periods you need to test hearing, eyesight, fitness, and so forth. If you're in a manufacturing and it's a lot of heat, then you need to look at those types. So you need to look at what exposure. If it's noise, what is the exposure? You need to do hearing tests, and that needs to be covered by the employer. It's separate from a medical scheme cover, and it falls outside of the PNB regulations. But you often want to integrate that with your primary care. So, because my patient is, or my employee is one person. So if I can integrate it better, the better care that person will have. Say it's a diabetic patient. The diabetic patient works in an environment where there may be injury because it's a bit of a manual process. Then you need to make sure that you be able to care for that patient. The patient goes for the regular diabetes checkups, which are not an occupational health checkup, but will make sure that the patient's fit for work all the time if his sugar is well controlled.